2 out of every 3 Alzheimer's patients are women. This isn't bad luck. It isn't coincidence. And it is not inevitable. For decades, doctors assumed women simply lived longer, so of course they'd develop more dementia. But new research is dismantling that assumption completely. Women don't just get Alzheimer's more often, they get it faster, younger, and their symptoms progress more severely than in men. And here's what nobody is telling you. There is a specific biological window, one that most women don't even know exists, where your risk is being quietly shaped right now. Stay with me, because by the end of this video, you'll know exactly what that window is, why it matters, and the 5 research-backed strategies that can help close it. Let's start with the numbers, because they are hard to ignore. Alzheimer's disease affects approximately 55 million people worldwide. Of those, nearly 65% are women. In the United States alone, a woman in her 60s has roughly a 1 in 5 lifetime risk of developing Alzheimer's. A man that age? About 1 in 11. For years, the medical community wrote this off as a simple longevity problem. Women live longer, more years means more exposure to aging, case closed. But researchers at institutions including the Alzheimer's Association and the University of California have now shown that age alone doesn't explain the gap. When you control for lifespan, women still show higher rates of disease. Something else is happening inside the female brain. And the most dangerous part? It starts decades before the first memory slip. Here's why. Studies using brain imaging technology now show that women in their 40s and early 50s, people who feel completely fine, already show measurable differences in brain metabolism and amyloid plaque buildup compared to men of the same age. The disease clock starts earlier, the runway is shorter, and the warning signs are almost always missed. So what is actually going on inside the female brain? There are 3 key biological factors that researchers now believe drive this disparity. Factor 1. Brain metabolism. Women's brains, on average, are more metabolically active than men's, which sounds like an advantage, but it also means the brain is working harder, burning more energy, and is more sensitive to disruptions in that energy supply. Alzheimer's has been called a metabolic disease of the brain, sometimes referred to as type 3 diabetes, because it's closely linked to how efficiently brain cells use glucose. When that efficiency drops, women feel it harder and faster. Factor 2. Neuroinflammation. Women's immune systems are naturally more aggressive. This is why women generally mount stronger responses to vaccines and infections. But that same immune reactivity means the female brain can tip into a state of chronic, low-grade neuroinflammation more easily. And neuroinflammation is one of the primary drivers of neurodegeneration. Factor 3. The APOE4 gene. You may have heard of this gene. It's the strongest known genetic risk factor for late-onset Alzheimer's. Roughly 25% of the population carries at least one copy. Here's what most people don't know. Carrying the APOE4 gene raises Alzheimer's risk significantly more in women than in men. For men with one copy, the risk roughly doubles. For women, it can triple or even quadruple. Same gene, profoundly different outcome. But the single biggest factor, the one that connects all 3 of these, is something almost every woman will experience, and the timing of it could change everything. Estrogen. Most people think of it as a reproductive hormone, something that manages cycles and fertility. But estrogen is also a powerful neuroprotective compound. It supports glucose metabolism in the brain. It reduces neuroinflammation. It promotes the production of acetylcholine, a key neurotransmitter for memory. It even helps the brain clear amyloid proteins, the sticky plaques central to Alzheimer's pathology. During perimenopause, which can begin as early as the late 30s and typically runs through the mid-50s, estrogen levels fluctuate wildly, then fall dramatically. Research from the Weill Cornell Medical Center shows that during this period, women experience measurable reductions in brain energy metabolism. In some women, this drop in brain metabolism mirrors early changes seen in Alzheimer's patients. This is the window. This is where the groundwork for future disease is either being laid or actively resisted. The good news, and there is very good news, is that this window is also when intervention is most powerful. Let's talk about what actually works. These are not supplements pulled from a wellness blog. Every strategy here is supported by peer-reviewed research. Strategy number 1. Aerobic exercise, the single most powerful tool. Exercise, specifically sustained aerobic movement, increases production of BDNF, brain-derived neurotrophic factor. Think of BDNF as fertilizer for your neurons. Studies show that women who engage in moderate aerobic exercise 3 to 5 times per week have measurably larger hippocampal volume, the brain region first destroyed by Alzheimer's. 150 minutes per week, that's the target. Walking counts. Strategy number 2, metabolic health. Control what you can control. Remember the brain's glucose problem? Managing insulin sensitivity is one of the most direct ways to reduce Alzheimer's risk. This means limiting ultra-processed foods and refined carbohydrates, prioritizing protein and healthy fats, and maintaining stable blood sugar throughout the day. A continuous glucose monitor can be a powerful awareness tool for women in perimenopause. Strategy number 3. Sleep, the brain's janitorial system. During deep sleep, the brain's glymphatic system activates, essentially flushing amyloid proteins and metabolic waste out of brain tissue. Consistently getting less than 7 hours of quality sleep accelerates plaque buildup. For women navigating night sweats and hormonal sleep disruption, this becomes especially critical to address, not tolerate. Talk to your doctor about sleep interventions. This is not optional maintenance. Strategy number 4. Cognitive engagement plus social connection. Research from the Rush Memory and Aging Project found that people with strong social networks and ongoing cognitive challenge had significantly lower rates of Alzheimer's, even when their brains showed physical signs of the disease at autopsy. The brain builds resilience. Scientists call this cognitive reserve. Learning new skills, reading, meaningful social engagement, these are not soft lifestyle choices. They are biological protection. Strategy number 5. Talk to your doctor about the hormonal window. This is the most underutilized tool. Emerging research, including the landmark KEEPS trial and work from Dr. Lisa Mosconi's lab at Weill Cornell, suggests that hormone therapy initiated during perimenopause, for appropriate candidates, may support brain health and metabolic function. This is nuanced. It is not right for everyone. The timing, the type, and the individual context all matter enormously. But if you are between 40 and 55 and this is the first time you're hearing that estrogen has anything to do with your brain, that is a conversation worth having with a healthcare provider who takes it seriously. You now know more than most primary care doctors discuss in a routine visit. But knowing isn't enough. Here's what to actually do with this. Here's how to take everything we've covered and turn it into something real. This week, schedule a full metabolic panel if you haven't had one recently. Ask your doctor to include fasting insulin, HbA1c, lipid panel, and inflammatory markers like CRP. These are windows into your brain's future, and most people never ask for them. This month, audit your sleep. Use a free tracking app or simply commit to a consistent bedtime window. Add 3 aerobic sessions per week. Start modest. Build a habit, not a sprint. Ongoing. If you are 40 or older and experiencing perimenopausal symptoms, irregular cycles, sleep disruption, brain fog, or mood shifts, document them and bring them to your doctor, specifically framed around brain health, not just quality of life. Brain health. That framing changes the conversation. And if you're watching this for someone you love, a mother, a sister, a friend, the most important thing you can do is share this video. Because the window for protection doesn't stay open forever. Alzheimer's is not written in stone. It is not simply what happens when you get old. And for women, who carry a disproportionate share of this disease's weight, it is not inevitable. The science is moving fast. The protective strategies are real. And the most important moment to start using them is not after a diagnosis. It is now. If this video gave you something useful, a number, a strategy, a conversation to have, consider sharing it with the women in your life who deserve to know this. And if you want to go deeper on any of the topics we covered today, metabolic brain health, hormonal neurology, or the science of cognitive protection, subscribe and hit the bell. That's where we spend our time here. Take care of your brain.